And Grace Sukchan is the manager of the extended program on immunization. So it is my pleasure to chat with Grace this morning. Good morning.
Good morning.
Thank you for joining us this morning. Now, in this season of COVID, where so many people are focused on that virus, many people are not thinking of anything else, but we are also in the influenza season. Tell us a little bit about the influenza virus itself.
So let me start by saying that the influenza season have started for us. It is October to May of the following year. And influenza is a contagious respiratory illness caused by the influenza virus that infects your nose, throat, and sometimes the lungs. It can cause mild to severe illness, and at times it can lead to death.
Now, we're hearing this term thrown around a lot these days, and it's flu-like symptoms. But what are the usual signs and symptoms of the flu?
Right, so your normal flu-like symptoms will be fever or feeling a little bit feverish, chills, cough, sore throat, runny or stuffy nose, body aches and pains, headaches, fatigues, and some people may have vomiting and diarrhea, but this is rare.
Okay. Now, how is the flu usually contracted? Is it a droplet-like thing, as we are told that the COVID-19 virus is like? Is it airborne? How is it transmitted?
So people with flu can spread it to others up to 6 feet away,
wow,
which is similar to COVID. So most experts think that the flu virus spreads mainly by droplets made when people with flu cough, sneeze, or they talk. These droplets land in the mouth or nose of persons who are nearby and possibly can be inhaled into your lungs. Again, similar to the COVID-19 virus.
Is there that aerosol effect that has been described in some cases?
That is correct. That is correct. And interestingly enough, the COVID-19 and the flu have similar symptoms. Firstly, the COVID-19 and the influenza, they're both a respiratory disease, which
right,
presents as a wide range of illness from asymptomatic or mild to severe in some cases. Secondly, both are transmitted by contact or droplets and fomites. As a result, some public health measures which we have implemented for the COVID-19, such as hand hygiene, good respiratory etiquette, meaning you cough and sneeze into a tissue and you dispose of it, or you use the crook of your elbow if none is available. And of course, you're washing your hands with soap and water. And if that is not available, you use a hand sanitizer. And in the case of COVID, we are asking persons to wear a mask, which further protects you. And all of these measures is aligned both for the flu virus and the COVID-19.
What about the infection potential between both of them? Are they similar between the COVID-19 virus and the influenza virus?
Yes, it is. One thing I want to highlight in terms of differences between the COVID-19 and the flu is that with COVID-19, persons may have change in or loss of smell or taste. And that's how you can actually differentiate, but they're so similar. They're transmitted basically the same way.
Now, let's speak now about vaccinations. Why is it necessary to be vaccinated every year?
So every year you have new flu vaccines being released. And this is to keep up with the rapidly adapting flu viruses. When you get vaccinated, your immune system produces antibodies to protect you from the viruses that is included in the vaccines. But over a period of time, the flu vaccine, the antibody levels decline. And that is why we give flu vaccines every year. Now, it's important for persons to understand we have vaccines against a lot of diseases like measles, polio, tetanus, diphtheria. But where we could give that 1 dose of vaccine or 2 doses, as the case may be, and you may not have to get it again. The influenza virus is different, meaning every year there's a change in the makeup of the virus, and therefore vaccines have to be produced every year to adapt to that change so that persons can be protected. It's not a one-off.
Does the vaccine pose any danger to anybody in society?
The virus or the vaccine?
The vaccine.
The vaccines. All right. So like most medications and even vaccines that we would normally get, some persons might take a polio or tetanus or something and might get a mild reaction. It's the same thing with the flu virus. Some persons complain of mild redness, irritation, discomfort or pain at the site of the injection. In some cases, persons may complain of a sore throat, runny nose, and in severe cases, maybe persons might have headaches, vomiting, but this is rare.
Why is the ministry encouraging the public to go get vaccinated?
That is correct. We have the vaccines available at all public health centers throughout Trinidad and Tobago. There's a list of health centers that's offering the vaccines Monday to Friday between the hours of 8 to 4. And we encourage persons to go on the Ministry of Health webpage at www.gov. Sorry, let me say that. Okay, I see it on the screen, www.health.gov.tt. These are the list of health centers here that is offering the vaccines 8 to 4. That being said, all health centers are offering the vaccine. So if you belong to any particular health center and you go for whatever clinic you belong to, you are going to get the vaccines. It's available. You're not going to be turned away. But I also want to point out that apart from everybody being encouraged to get the vaccines, there's a particular high-risk group that we really want to go out there and get the vaccines.
Right.
Because if they develop the influenza virus, it can be severe and maybe even fatal for them. Remember, we said earlier, sometimes it's asymptomatic, but then there are some persons that are going to get the symptoms and it will be severe. And these are children between the ages of 6 months to 5 years, adults over 65 years of age, persons suffering from communicable diseases such as diabetes, hypertension, heart disease, persons with respiratory illness like asthma, chronic obstructive pulmonary disease, persons who are immunocompromised, HIV positive, lupus, sickle cell disease, cancers, healthcare workers. We're also looking at members of the national security forces, immigration, customs, who face a lot of people on a daily basis as they go about doing their work. These are the persons that we are encouraging to take the vaccine so that it can be protected.
All right, and with that, I want to thank you so much, Grace Sukchan, manager of the extended program on immunization. Again, you could go on the ministry's website and Facebook and other social media pages to get more information. They have a vaccination drive happening right now, so you could go online to get more information.